This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com. Dr. Este Geraghty is Chief Medical Officer and Health Solutions Director at ESRI, and she leads efforts into their fast-growing health and human services sector. Formerly the Deputy Director of the Center for Health Statistics and Informatics with the California Department of Public Health, Dr. Geraghty led a number of key programs and engaged in statewide initiatives in health information exchange and interoperability. Welcome to the show, Dr. Geraghty, and may I have the privilege of calling you Este?
Please do, Steve. It's a pleasure to be here.
Well, Este, it's great to have you on the show. The first thing I'd really like to do is jump into this term GIS, Geographic Information Systems. I'd like you to explain what GIS is all about, and then some of the big value that it's bringing in healthcare.
It is a confusing term. A GIS is a Geographic Information System. So it's like any information system you might have. It just has that geographic component to it. And that geographic component is really important because it starts to answer questions about where things are happening, what's changing, where is something important, where can I predict what's happening next. So we answer that where question all the time. And the value of that is it helps you to be more efficient in the work that you do. You can streamline your processes and target your interventions to the right place at the right time.
It's not just mapping, right? I mean, it's mapping, but there's so much more that's applied to it.
Yes, it's really a platform approach, which basically means that it has multiple components at the simplest level. But you're right, analytics are where the power of geography comes in to answer really important questions about why is something where it is. You might take an infection outbreak, for example. It's not just the fact that you have an outbreak. It's the why did it happen in the place where it did? Why is it spreading in a particular direction? And geography helps you to get at all of those kinds of questions.
Let's get into the history of the company, of ESRI, ESRI. I did a lot of research on the company before today's interview. First of all, I really like the history of the company. It's been around for 50 years, I believe, a little over 50 years. You've got just a really interesting gentleman who's your CEO. He's always been the CEO of the company and the founder. And I'd like you to talk about the company, talk about, maybe a bit about their history and, where they've really seen a lot of their growth.
Sure. Well, gosh, Steve, you've done your research. Maybe you know more about the company than I do, but it was founded in 1969. And you're right. Jack Dangermond is the figurehead, our president, our visionary leader, and has been since the beginning of the company. And he's partnered with his wife, Laura Dangermond. So basically, Jack came from a family of immigrants who came to the U.S. from Holland, and his parents started a nursery. And it's interesting because I think that those beginnings really formed Jack in many ways. He became really interested in environmental science and conservation and became a landscape architect. And then in high school, he met Laura, and they went on to the University of Minnesota because he wanted to study urban design. And he got an idea in his head that for urban design, doing some computerized mapping, which had just barely begun in the world, would be a really cool thing to combine with his work.
Right.
And so he went to Harvard. And Harvard had this laboratory for computer graphics and spatial analysis. And they were really pioneers in this early development of digital maps, a geographic information system. And so after that, he was inspired and he created ESRI, which stands for Environmental Systems Research Institute, the original name of the company. And it was a consulting company, but it did incorporate that geospatial component. It took all the way until 1982 before we had our first software product launched, and then just got bigger and better from there.
Yeah, you talk about like hanging in there and just following that vision and the dream. though I've never met Jack personally, hopefully I get to meet him at some point. Here's a company that starts basically just about when Woodstock is starting in 1969. It goes through essentially land use in the beginning, this idea of mapping and carrying data and getting insights. Then it goes into real estate. Then it goes into the oil industry, the gas industry. And really now it's hit healthcare. I think the company made a little over $1 billion last year. You got about 3,200 employees. I know that there's a big market share that you command in this industry, which is always helpful. Let's jump into healthcare. Here comes ESRI. Tell me a little bit about what's exciting about this. What's exciting about the mapping, the data, the integration, the insight around GIS and really what it means for healthcare?
Well, that's a hard question for me to answer in just the short time we have together, Steve, because I think everything is exciting about it. I see this technology as completely transformational. Partly it goes back to those roots of epidemiology. Folks who maybe are on the public health side of your listeners will understand this reference. When we look at the epidemiologic triad, there is the agent of disease, the host who may be susceptible to disease, and the environment. Now, we've gotten into all of the omics, right? Genomics, proteomics, et cetera. That really focuses on agents of disease in that microscopic level and getting down into it. The susceptible host, of course, in this case, we're talking about humans and susceptibilities, from any different number of measures. But that focus on the environment has not really been exploited to the extent that it could be. I mean, we've certainly seen lots of examples of how putting everything in the context of where people live, work, play, do their business is important, but certainly underexploited in health. So there's just vast possibilities. And frankly, the technology wasn't really available just a decade or so ago to make that environmental analysis, and I mean environment in the broadest context, even possible.
We spoke off air about a gentleman named Edward Tufte, and I know that you are a follower of his. I know that some of his statements are particularly strong ringing to you. Is there anything particularly about him that you can share with the audience that you feel is important about, in particular, GIS technology?
Absolutely. So for your listeners who may not know Edward Tufte, he is a Yale professor who I always say, and people say is the guru of the visual display of quantitative data. So obviously his expertise is very relevant nowadays when we're trying to continue to make sense of data. But he once said that the commonality between science and art is in trying to see profoundly, to develop strategies of seeing and showing. Honestly, the first time I heard about GIS and understood it, I felt like I saw profoundly. And that's the kind of reaction that we get when we show people demos and what geography can do to help them in their business and health. They just get really excited and they see things profoundly. And I'll even mention Tufte said another thing, which I particularly like. He talks about all of this information design work, and he says a metaphor for good information design is a map. Hold any diagram against a map and see how it compares. And it's absolutely true. People look at a map and they get engaged right away. They want to see where are things, or what is the condition of things where I live, or where my family lives. And they're already interacting with the information in a much more personal way. So maps communicate well, and of course there's all of the analysis and other work that goes behind them that makes it a very powerful tool.
Yeah, let's talk just for a second about Hurricane Harvey, Hurricane Irma. ESRI was very much right there in the thick of things. Maybe you could just give our audience an idea of just how powerful the technology is that ESRI has, and maybe where it was used to add a lot of value.
Well, a lot of our customers that respond to the hurricanes use our software, including the Red Cross, FEMA, and Direct Relief. So Direct Relief, for example, is an organization that provides medical material aid in the face of a crisis. So they get supplies ready, and they also provide funding as needed. So one of the things Direct Relief did was pre-locate supplies based on where they understood vulnerable populations to be and need given the hurricane and the likely areas of storm surge. So they pre-located supplies, which made them available much more quickly once the storm hit.
I mean, just on a high level, Este, what are some of the things that ESRI was looking at in terms of where to place those supplies, how to distribute?
Right. So one, I think they're looking at populations that are particularly vulnerable. So they may be the older populations and the younger populations. But when it comes to medical supplies, they're looking at where there are people with more diabetes, for example, so that they can supply insulin where it's needed when people may need to leave their home in a hurry.
Right. Okay.
So all of those things are mappable.
Because ESRI was used, what were the results in terms of perhaps some actual numbers that came out in terms of Harvey and Irma and where you were able to distribute, maybe the sort of difference that it made?
Sure. Well, let's take diabetes as a continuing example. So if you can ensure that people can get their insulin on time, or at least quickly, it's that time frame that makes all the difference, right? Then you can avoid unnecessary emergency room visits or hospitalizations for people who then have gone too long without medication for an important chronic disease like diabetes. So that can go from saving lives to saving money in a health system, and also making sure that those people who are seen in emergency rooms are the people who need it most. And so you avoid those unnecessary visits for missed medication, for example.
Yeah.
But there's other things that you do in the face of a disaster. There's, providing public information was really critical during these hurricanes. Where can people find shelters? Where is the transportation system reliable versus unreliable, washed out? Or in the case of Irma, where are there gas stations that still have gas? All of these things are really important to getting people to safety, making them feel comfortable that they know the information, and they can even contribute information. There are applications for crowdsourcing. People can post pictures, video, comments, so that their voice is heard and responders get new insight into areas in trouble.
As you come into healthcare with GIS technology, what are the areas that ESRI really segments out in terms of its offerings? I mean, its products.
Let's start with the oldest, most mature users of geographic software, and that would be public health. Now, public health has a vast portfolio, I'll say, of uses for GIS, but here's some of the ones that we talk about in the last couple of years. Using GIS to tackle the opioid crisis, planning your vector-borne disease surveillance and control activities using GIS, dealing with homelessness and connecting homeless people to resources or predicting where homelessness is likely to occur, or doing your annual or biannual homeless point in time count for either sheltered or unsheltered individuals who are experiencing homelessness. So that's just a sampling, but public health is a longtime user of GIS, and you saw some overlap with the human services, maybe with homelessness or opioids getting into mental health. But there's also the private side. Would you like a few examples there?
Yes, absolutely. Lay it on us.
All right. Well, for private or commercial health entities, and here I'm talking about hospitals and health systems, as well as health insurance payers, among others, but those would be the two areas I'm focused on. We're looking at things like hospital strategic planning. How do you plan your growth strategy? And once you've figured out how to beat local competition and provide the best service mix for the actual needs of the community that you serve, then you can use GIS in your marketing department to engage with those communities and bring them to your services.
Yep, great point. One of the things, too, that I think a lot of people forget is that companies that do mergers and acquisitions, the studies are very clear that 7 out of 10 times the value is actually decreased after doing it. The way I look at it is you're getting the very best information, not just in serving the communities, but pulling the best level of data forward so that you don't make a overinvestment, which will just come back to hurt the companies in the long run.
Absolutely. Well, in healthcare, I think that it's such an important area of our work in this country, and people are very altruistic and good people helping others, right? And we have that kind of vision in healthcare, but we need to also think of healthcare as a business.
Yeah.
And to make logical decisions for our capital investments that not only serve the institution, but also better serve the population. And so we try to help healthcare organizations have the same kinds of tools that the retail industry has, for example, so that they can make the same kind of decisions and save resources so they can be better applied to advancing healthcare.
This is Dr. Steve Ambrose. As a healthcare influencer, I'm in contact with some of the brightest minds and most powerful leaders in the industry. But my best effort comes from outside the booth. Knowing how to engage patients is an art, science, and philosophy that I know very well. I'm a hired gun that brings expertise to healthcare organizations of all types. You've heard my words. Now read my thoughts on my free white paper called The 7 Mistakes Made in Patient Engagement. Just go to redhothealthcare.com/learn. That's redhothealthcare.com/learn. While you're on the site, dive into my consulting and speaking services and schedule an initial call. You won't regret the uniqueness, benefits, and results I can deliver for you. And now, back to the show. I'm really hot on the opioid addiction issue today, and in particular, I was pleased to see some of the inroads that ESRI is making with its technology. I'm just quoting from an article that I read online that Direct Relief, which we just talked about before, they are planning, in a partnership with Pfizer, to get out 1 million doses over time to those people suffering with opioid addiction. I think I'm reading here that they put out 30,000 doses so far, went out to 126 health centers across the country. Essentially, they're using the mapping, and they're using the mapping in conjunction with a partnering with Pfizer to reach the right people in the right places at the right time. I think that's great stuff. And maybe you could speak a little bit more about that and about maybe what else is going on with opioid addiction and ESRI.
Sure. Well, they do fantastic work. And as you can imagine, the question when you're about to deliver naloxone to individuals across the country or organizations across the country is where? Which ones do I send it to? How do I prioritize? And you may do that in a number of different ways. For example, you may be looking at vital records data to find out where are people dying from opioid addiction at the highest levels. That's maybe where you prioritize who gets the naloxone. Or you might be looking at police data and figuring out where are the overdoses happening. Maybe they're not all leading to death, or emergency room data. So it's that logistical piece that I think GIS helps a great deal with in this particular project. But there's more to it. How can you do outreach to different communities? Geography can help you to communicate with communities in ways that they prefer. So, for example, one community may like to get their information from newspapers, while another one listens to particular radio programs.
Right.
We look at that kind of market data, and that helps organizations to tailor and target their outreach appropriately. But you can also look at other kinds of applications like safe drug drop-off locations. Many counties throughout the country have used a simple template that we put online, and they download it. They can have it up and running in a very short period of time, and they can show their constituency where they can go to drop off their medications that are unused or expired. And that keeps it out of the hands of people who could abuse or misuse that medication.
Tell me about the main products of ESRI. You know, you have a large platform with different components, just on a very high level. What do you have under the hood at ESRI that is just really powerful for consumers, for users?
Well, our flagship product is ArcGIS, and ArcGIS really, it's an integrated system of systems. So it's your data management system, and it's your field data collection system, or your spatial analytics system, and your visualization system, and your collaboration and engagement system. So ArcGIS contains all of that. And then we also have some other kinds of premium products that people can look at separately or in conjunction with the ArcGIS platform. And they all work together. So let me give you an idea of one of those products. We talked about it before, the idea that a hospital's growth strategy might rely on this geographic knowledge of what they're doing, competitors are doing, and the community need. That's all done in a product we have called Business Analyst. So it does bring that commercial, retail kind of knowledge directly to the hands of hospitals and other organizations who are trying to do business planning and strategy.
Yeah, you know what I like too about this? We talked about it off air, SD, but the fact that today there's so much changing with health systems and hospital chains. I mean, this is my area where we get into their need to grow. So a lot of the time what they're doing is, they're just doing a lot of M&A activity. They're buying up different practices in their community. They're buying up, other hospitals, other chains, that sort of thing. But as we move forward, particularly as consumers become so much more important now in healthcare because more dollars are now being spent by consumers out of their share than ever before as that switch is happening. Marketing is changing. Segmentation is changing. You've got hospitals and health systems that are not just looking at M&A activity to grow. They're saying, you know what? Whether it's in our community or remote communities, we've got to start winning loyalty. We got to start winning like the minds and the hearts of people, not just to help keeping them healthy, but to help them stay in touch with us and want to stay in touch with us. So we want to win them over. And, to that extent, you just touched on this before, and I like that ESRI is more than just looking at what you're going to do for mergers and acquisitions and sort of looking at populations. You can really hone it down into the individualized level. And I know that, you do have retail marketing companies and retail advertising companies that are using your products this way.
Absolutely. And you can do things that are maybe outside of the norm, like healthcare. If you're looking to place a new clinic, there may be a number of things that you want to consider that might not be in your typical demographic or market information that you can do with GIS. For example, your population may generally need to use public transportation to get to your facility. Well, you can start to plan facility locations near common public transportation stops, and you can see that clearly on the map. You can look at crime statistics because obviously you want to keep your patients in the safest possible area. These are great different kinds of data sets to pull in as you're doing your site selection and your capital investments.
Now let's switch over, if we could, from the growth side into what is becoming just on top of everybody's mind now, this quadruple aim initiative. We talk about decreasing cost. You're talking about increasing quality of care and improving the patient satisfaction. And then, I would even add on to that, and the last piece would be, physician burnout, the culture. Where is ESRI making a difference there?
Well, I think that every organization is going to have their unique needs, and we certainly have the tools to help move those along and create a program for them. But I do have some really good examples, and one story that I really like to tell is a story maybe people have heard of. This was about the Camden Coalition in New Jersey, and they're an accountable care organization, and they were actually written about by Dr. Atul Gawande in 2011. He wrote an article called The Hotspotters. And basically, this is a story of readmissions, which obviously is a costly issue for hospitals and generally represents a preventable problem much of the time. So what the Camden Coalition did was they studied their super utilizers. So these were people who were being readmitted to the hospital frequently and also using emergency room resources unnecessarily.
Right.
And normally when people look at readmissions, a lot of times they'll analyze readmissions by the disease type. So for example, if you have a lot of readmissions around congestive heart failure, you might say, I need to work on my program for congestive heart failure. Maybe I need to send people home with a scale or better instructions for how to deal with their disease and when to come back. But instead of doing that, the Camden Coalition said, we're not going to look at disease type. We're just going to look at complex patients, no matter what their disease type is. And they analyzed them spatially. And they found that a large number of those individuals who were using so many services lived in high volume, high density, but low income housing complexes. So they actually put small clinics in 2 of those complexes. And even with the cost of that, they were able to reduce the cost of readmissions by 50%.
Amazing.
So that's a clear improvement or use of the quadruple aim, right? They decreased cost, no question about that. They increased the quality of care because people with chronic diseases now were getting the primary care that they needed to stay well, and also were getting their acute concerns addressed because they had that PCP. They were also, obviously, patients are going to be more satisfied when they get the care that they need. Nobody wants to spend time in the hospital. And I would say to your comment about physician burnout, that in my experience, if I feel like my efforts are actually having an impact, I'm much less likely to be burned out. So these kinds of programs really fit in with what geography can offer.
It opens doors. The way I look at it is you do certainly have clients in the healthcare space, but there's a really big need here as health systems and hospitals are really trying to get in better touch with their community. It's more than just outreaching and sort of sending them marketing messages. It's really knowing them. And as you talked about, there really is no limit on the amount of data that you can integrate into your solutions here, the mapping solutions, and then what can start being looked at visually, which makes a huge difference. One of the things, if listeners haven't been thinking about it yet, I've always been thinking about is, okay, you've got ESRI, great technology. If I'm not mistaken, I think that ArcGIS product has got 40% of the market. I mean, it's a big percentage of the market that ESRI has in terms of market share and clients. But what about Google Maps? I mean, I'm thinking, okay, we've got mapping technology. Google Maps, Google's a monster product. I use Google Maps all the time. And I also know that Google Maps has a paid product that companies use. Where's the difference between what ESRI has and what Google Maps offers, perhaps its business clients?
Yeah, so there is a difference, and actually the world of Google products can be maybe a little bit confusing. There is the Google Earth Enterprise, which was what a lot of organizations would use for their GIS. That is not a supported product anymore. It's a free open source product. So basically, Google Earth Enterprise is really a lot of open source libraries that Google doesn't necessarily maintain or support, but is available to people. Now, there's also Google Earth Engine, and that's an open source project around big data analytics in the cloud environment. That may work for people on some scales, but if you're worried about your protected health information, you may not want to deal in the cloud environment unless it's a private cloud.
Right.
What ESRI offers is a commercial-grade enterprise technology. It's really for that business-to-business solution. And in fact, when Google Earth Enterprise decided to discontinue that product, we worked with them to migrate folks over to ESRI products to make sure that they had an ongoing, continuing solution. So I normally think of Google as a consumer-facing application, easy to use. We can integrate with Google Maps as well. But ESRI is where you get all of that analysis, all of your mobile applications. You've got big data analytics, and that can be done on premises or in the cloud.
Okay, and I'm going to tattle on you a little bit here from our off-air conversation. You gave me a quote that hit me, and it stayed with me up until this interview here. You said that Google never happened or could never happen without ESRI. And so I'd like you to explain that a little bit.
Sure. Well, I was drawing from something that I remembered, and after our conversation, I went and looked it up. There was a Forbes article that was written about our president, Jack Dangermond, in 2016. And in a part of that story, there was an interview with a gentleman named John Hankey, who is a former leader of Google's mapping efforts. And what he said was that Jack kind of created this industry. So he created this digital mapping industry. And he also noted that several of Google's products were really built on the shoulders of what Jack created. So my interpretation of that was there would be no Google without an ESRI.
All
or
right.
without a jack at least.
All right. Tell me a little bit about what the plans are for moving forward here with ESRI. You're making a bigger push in healthcare, certainly as the GIS leader. How are you looking to utilize the GIS technology in terms of healthcare consumerism? In other words, are you planning to ever make any products or have any products that are outward facing to the consumer?
We do focus on the business-to-business relationships, but I can mention a few different ways to think about that. One thing is that our platform has these collaborative tools in it. So it allows the businesses that we serve to outreach to their customers and have open engagement in that way through different kinds of things like open data, interactive story maps, crowdsourcing, social media, and even consumer-facing apps. So all of that is available to our customers. Now, we are developing something that is, you might call it, we call it a hub, but it's a community participation platform. And this is sort of an interesting idea, and it's fairly new. So I'm going to give you an example with the opioid crisis.
Oh, good. We're getting it fresh. Okay. All right.
Very fresh. So the opioid crisis has a number of stakeholders, right? I mean, you mentioned a number of them. There is pharmaceutical companies, right? There's public safety and emergency responders. There's police, healthcare, folks in emergency rooms, working in emergency rooms or in hospitals. There's human and social services and all of these rehabilitation facilities, and citizens. And in a hub environment, in this community participation platform, people can come together to work on specified initiatives and really interact for their part where they can contribute the most. You don't have to be an expert, you just have to be interested. So we're developing that kind of environment, which does involve consumers. And then lastly, I'll say that our business partners, and we have nearly 2,000 business partners, build solutions on our platform much of the time, and some of those solutions are consumer-facing apps. One that I'll mention is related to helping individuals schedule urgent care appointments with their local providers of healthcare. So they go and create contracts, this company, with providers, and the consumer benefits by being able to download an app and say, you know, I fell and I've hurt my arm and I need to see the first available appointment anywhere within 10 miles or 15 miles.
Yeah.
And this app will help them find that.
Yeah, I love it. I love it. As we get more into healthcare consumerism, you know, really looking to capture more of those consumers by, I mean, frankly, adding value. You're adding value. You're solving real needs. Give me some of the most common misconceptions about GIS.
Sure. Well, the first one is, I already have mapping. I already have GIS, or it's just a map. So we spend a lot of time trying to educate our customers and our business prospects that there's a lot more to it, and that but there's a great deal of analysis and power. And then, of course, all of these kinds of mobile and business facilitation applications that people can take advantage of. So misconception number one, it's not just a map. So misconception number two is kind of this story of open. So a lot of people think of ESRI as a closed proprietary system, and we're not. So there are certain patterns to being an open system. One is open standards, and we participate and practice open standards. There's an organization called, for short, OGC, the Open Geospatial Consortium, and we work closely with them to make sure that we are compliant with open standards. There's also, as a component of open, integration with other kinds of business systems, or this focus on interoperability. And so we're always working on that, and we talk to big customers that folks out there are using SAP, Microsoft, and others, so that we're fully interoperable with those systems. And then the last one is this idea of open APIs, or an open developer environment. And we certainly have that, so that developers can leverage the APIs and the SDKs to create wonderful applications. And then the third and last one that I'll mention is people worry that they can't use geospatial because of protected health information or data security issues.
Right.
Because obviously we're about addresses and locations of different sorts. The first thing I'll say about that is we absolutely pay attention to all of the common certifications like FedRAMP, FSMA, HIPAA, and have a website actually called Trust ArcGIS, where people can read about what we're compliant with and what our levels of certification are. But I like to tell people that within your own firewalls and your own environment, you can do all sorts of analysis at the address and individual level if you want. It's about the sharing of that information and the visualization of that information. And we have documentation about how you can properly aggregate data or geomask data so that you don't have identifiable protected information.
So the other thing I wanted to ask too, Este, if I could, is what about advisory services? So I'm a growth officer for a company, for a health system, let's say, or I'm a senior VP of business development, and I say, boy, I'd really like to use this. We don't have experts here on staff that know GIS. Is there some sort of a hand-holding you can do with us to help us in terms of integrating this and maybe how we can make it best work with our system or our marketing or where we want to go in terms of our M&A activity?
Absolutely. I mean, ESRI is a full-service company, and we, and I will say this, and I mean this truly, we love our customers and we want to partner with them and have long-term relationships with them. I mean, people who work for ESRI, I think if anybody gets to know this, you'll know that ESRI employees are passionate and they got into this business because we believe that in our own way, we can help our customers change the world. So we have expertise in different industry areas that we serve. For example, ESRI hired me as a chief medical officer, and I have experience in public health and internal medicine. And then we also have just an array of different technical support mechanisms, from the usual phone support to rent a tech for a short-term project to kind of these long-term roadmaps that will bring in system architects in our professional services group and really help an organization plot and plan how they want to leverage a location strategy over the next year, 2 years, or 5 years. So we're there to hold your hand, and we don't feel that we're successful unless our customers are successful.
Dr. Este Geraghty, Chief Medical Officer and Health Solutions Director at ESRI. And I want to thank you so much, Este, for coming onto our show and for just distilling so much about this GIS technology. Sounds like to me that, and just through the research I've done, that it's blue skies ahead. Thanks for being on, and we're going to definitely stay in touch with you.
Thanks, Steve. I really enjoyed talking to you.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.